Hello, my name is Zalima Crow. I am the nurse practitioner student today, and we are going to be doing your head-to-toe assessment. The blinds and curtains are closed for your privacy, we did go ahead and take your vital signs earlier today. Your blood pressure was 120/80, respiration rate was 17. Temperature was 99 on taken temporal non-contact. O2 sats was 100% on room air, and you reported 0 for pain, and pulse was 72. They did a Snellen as well earlier, testing for cranial nerve 2, and that right and left eye both came back as 20/20. Let's see. I'm assessing for just a general survey at the moment, and assessing for any nasal flaring, any signs of respiratory distress, any cyanosis in around the lips. Don't notice any of that. I'm going to go ahead and sanitize my hands. Alright, and we're going to go ahead and begin. So if you can go ahead and hold your hands together like this. Alright, so I don't notice any clubbing. I'm also going to just be assessing the skin, and it's something that I'm going to be assessing throughout the head-to-toe assessment as well. So I'm not noticing any edema. I am noticing some macules, but they all seem round and even. I don't notice any bruising, any unusual lumps. Noticing kind of on the chest as well. Alright, so what I'm going to do next is just, I'm going to go ahead and assess your hair. So hair is clean, no infestation, shiny, evenly distributed. Facial hair is also evenly distributed as well. Let's see. Okay, I'm gonna go ahead and grab some equipment here. So I'm gonna do some testings of the cranial nerve. If you can raise your eyebrows, squint your eyes tight, smile, open your eyes, puff your cheeks. Okay, relax. That would be cranial nerve 7 for the facial muscles. Next. Okay, I'm going to go ahead and touch you and let me know if it feels evenly. Does this feel the same as this?
Yes.
Does this feel the same as this?
No.
Does this feel the same as this?
Mm-hmm.
Okay, that's cranial nerve 5 for sensory. Let's see. Next, if I can have you go ahead and chew. Okay, that's good.
Blocking your camera. There you go.
Let's see. Okay, I'm going to go ahead and do the lymph nodes. Preauricular, postauricular, occipital, tonsillar, submental, superficial cervical, deep cervical. If I can go ahead and have you tilt your head for the deep cervical. I'm gonna do the supraclavicular and supraclavicular. Okay, I'm gonna go ahead and take a look at your eyes. So immediately I don't notice any redness, inflammation, or discharge. Irises are dark brown. I'm not noticing any red reflection. I'm gonna go ahead and take. Okay, so go ahead and look straight at me. Okay. Okay, so that pupil reacts. Wow. All right. Both eyes are equal and reactive. That also checks for perla and cranial nerve 3. Let's see. Sorry, just thinking about what else we want to do. So I'm going to go ahead and just do the eye exam. And then I'm just going to go ahead and look inside the pupil here. Okay, so here I'm able to move a little bit over here so I'm not blocking the camera.
Doesn't matter which side, apparently.
Alright, so I'm not noticing any lesions, detachment of the cornea, no leakage. Optic disc intact as well. Okay. Next I'm going to go ahead and check for an additional cranial nerve. If you can go ahead and stick your tongue out. Okay, can you move it from left to right? Okay. Can you push your tongue against your cheek? Okay, and on the other side, okay, good. Let's see, I'm gonna go ahead and switch equipments here. Let's see, trying to think if we missed anything with the eyes. I think that's it. All right, so next I'm gonna go ahead and have you, follow my fingers. All right, so you can go ahead and keep following. All right, so eyes reactive. We're just gonna do an H pattern here for cranial nerve 2, 3, and 4. Good. I'm gonna go ahead and do the ears now. So go ahead and tell me when you cannot hear right.
Yeah.
Okay. Next I'm gonna go, we'll do the, like Renee and Weber. So can you hear it here
Mm-hmm.
or here more?
That one.
Alright. Here or here?
Yeah.
Alright. Now go ahead and tell me, can you hear that?
Yeah.
Okay, so that would be the Renee and Weber hearing test. Let's see. Let me see. All right, so now I'm gonna go ahead and just assess your nose. Can you cover one nostril and breathe in? Okay, cover the other nostril and breathe in. All right, so I'm gonna go ahead and feel if there's any area of tenderness here. Yes or no?
Oh, no.
Here?
No.
Okay. I'm going to go ahead and look inside the nostrils, assess for any deviation. Okay, so no deviation is noted. Mucosa is moist and pink. No inflammation. No signs of drainage. What next? I'm going to go ahead and assess for any pain and tenderness. Any pain or tenderness of the ear?
No.
Ear?
A little bit.
Neck?
Mm-hmm.
Okay. I'm gonna go ahead and just do the ear exam. We're gonna go ahead and do it inside. Alright, I'm able to see the white reflex. Alright, no redness or drainage. Okay, and I'm able to see the light reflex, and again, no inflammation or drainage. I'm gonna have you, I'm gonna go ahead and take a look at the inside of your mouth too, and go, Alright, so here I'm just looking at the teeth, just gums, mucosal membrane, making sure they're pink and moist. Okay, can you go ahead and say stick your tongue out. Okay. Alright, so tonsils. Tonsils are about 1 bilaterally. Again, no redness, inflammation, any tenderness inside your mouth?
I had canker sore. Probably a little bit.
Yeah.
It's not funny.
Sorry.
It hurts.
Okay, so next I'm going to go ahead and feel for your trachea. Make sure it's midline.
Is that midline?
Mm-hmm. If you can go ahead and face that way, I'm going to assess your thyroid. Okay, if you can go ahead and swallow. Okay, so I'm going to push again on one side, swallow one more time. One more time, on the other side. Okay. So I don't feel any enlargement of the thyroid there. You can go ahead and face forward.
The camera adds a weight.
Let's see. I'm sorry, I'm gonna have you face to your left one more time. I'm gonna assess your neck.
Oh, okay.
Okay, so I'm gonna have you turn your head to the right,
Oh.
left.
Left.
Can you bring your ear to your shoulder? Okay, the other side. Alright, so I'm gonna do a couple movements. Just kind of testing for strength.
Sure.
So I'm gonna push up against, you can push against my resistance
Okay.
here. So there you go. Okay. Go ahead and squeeze my hand. Okay, open your hand. Okay. Again, squeeze my hand. Okay. Don't let me move you. Don't let me move you. I'm gonna do the same on your head. Don't let me move you. 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 Okay. All right. Go ahead and you can actually go ahead and lay down now. What I'm gonna assess now is for diastagmus. For any rapid eye movement, it also kind of helps assess vertigo. So if you can sit up, and then I'm gonna rapidly lay you down. Turn your head this way, and then I'm just going to be assessing your eye movement. All right. Sorry. Okay. And one more time.
Sure.
Turn your head that way. All right. I don't notice any vertigo there. How you feeling?
Tired.
Yeah.
Just tired.
Let's see. See, I'm gonna have you go ahead and sit up one more time. I know there's just a lot we have to cover.
That's fine. Okay.
All right, so I'm gonna do another cranial nerve assessment. This kind of test for peripheral vision. So if you can cover one eye. All right. Oh, well, open. Yeah. So I'm gonna hold a number in my hand. Go ahead and tell me what number that is.
2. 2.
Okay, but stay looking forward.
Okay.
No cheating. Okay.
3 maybe.
Mhm.
3. 3.
Okay. Go ahead and do the other eye.
1. 1.
No
1.
cheating.
1.
Okay, that's good.
No, 3.
All right. Let's see. What else are we gonna see now?
Jeez.
Let's see.
Let's see.
I'm just trying to remember. I don't like jumping around, but it seems to be happening. Okay, so I guess for peds, what we normally would do to assess reflection in both eyes is we would quickly, in a darkened room, kind of like shine the light on each eye. Yeah, we would typically cover one eye as well to see if the eye moves in any certain direction. Let's see. All right. Okay, so I'm gonna have you just turn face that way one more time. What I'm gonna do is just kind of assess your back here. Alright, so just observing vertebrae here. Again, I'm doing a quick survey of your skin. Noticing any abnormal macules, which I don't. Any pain or tenderness?
No. That's so good.
If you could go ahead and breathe in. For thoracic expansion, breathe out. Okay. Let's see. I'll go ahead and listen to tympanic sound. Or tactile primitives. Alright, see, I'm gonna go ahead and measure your diaphragm. Go ahead and breathe normally. Breathe normally. Okay. Go ahead and take a deep breath in. Okay, and release.
What are you doing?
Measuring your diaphragm. Alright, now go ahead and breathe normally. Okay, take a deep breath in. And breathe out and hold it. What?
Breathe out and hold it.
Yeah,
So I have no breath to breathe.
I know. Well, it's just for a second. All right, it's about 5 centimeters as well bilaterally. Still recording.
Yeah.
All right, I'm gonna go ahead and auscultate your lung sounds.
Okay.
Try to breathe in. Breathe in. Again. Okay. Sounds are clear. Alright, moving forward to your board. Go ahead and say 99.
99.
Again.
99.
Okay.
99. 99. 99. 99.
Okay. I'm gonna just do some percussion here. Alright, and then any pain and tenderness while doing that?
No.
Alright, I'm gonna go ahead and auscultate. Breathe in. Deep breath. Again. 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 Okay. And yes, again, lung sounds, excuse me, are clear. Anything else before we move to the heart? Let's see. Okay, so if you can, yeah, we did the front already. 99 for bronchophony. Let's see. We could also do basically doing the 99 only. I would have you whisper 1, 2, 3, 1, 2, 3, and then I would clearly hear when auscultating 1, 2, 3. And then also egophony, where again we would be doing E as opposed to 99 for egophony. So next we can go ahead and move on to the cardiovascular portion of the assessment. If you can go ahead and lay down. Okay, and then let's see where we can start. I'm going to go ahead and just start with the jugular vein distension. Okay, and then just observing for the pulsation. With any pulsation, we would measure from the angle of Louis, and then measure that, well, parallel to the floor, and then measure that, or the height of that, and then you would add 5 for centimeters. Okay, yeah, so jugular vein distension. Next, I'm going to go ahead and check for the carotid. Okay, that is a 2+ there. I'm also going to be noticing for any lifts or heaves in the chest area, and I don't notice any there. I'm going to go ahead and feel for any thrills. So, aortic, pulmonic, tricuspid, and then mitral valve. Okay. Yeah, you broke it, sorry. Alright, so the, let's see, so first intercostal splice, midclavicular, there, okay. Let's see, we're gonna go ahead and just listen to the valves here. Alright, so, let's see, so right sternal border, midclavicular, I can hear S2 predominantly, pulmonic, S2 predominates. Alright, and then right at the indentation for Erb's point, I can hear S1 down to the 4th intercostal space, the tricuspid, left sternal border, that's S1 predominantly. And then now the mitral valve. And that would be S1 would be predominate. Now I'm going to try to listen for S3 and S4, just pressing on the diaphragm or the bell with the mitral valve. Okay. And then the tricuspid. Erb's point. Pulmonic. Aortic. I don't hear any S4s there. Let's see, I'm gonna go ahead and palpate too. Nervous point, tricuspid, and mitral. Okay, that's a 2+ there. I'm also gonna go ahead. Well, normally we would listen to your heart in multiple positions, sitting and standing, to try to accentuate certain heart sounds. I'm going to go ahead and palpate your pulses. We'll do radial, brachial. Okay, that's both about a 2+. Okay, next we're going to go ahead and move on to the abdomen. Again, just continuing a skin assessment, no abnormalities, some macules noted. I'm going to go ahead and view for pulses here. Okay, I'm able to see that right about there. I'm going to go ahead and auscultate all 4 quadrants. Alright, I'm going to go ahead and switch to the bell to listen to vascular sounds. Alright, and I could clearly hear all vowel sounds in all 4. I'm actually going to go ahead and see if I can listen to the femoral. Just listening for any breweries. Okay, and no breweries there. I'm going to go ahead and do percussion next. Okay, I'll also do percussion of the liver border. Okay. I can just have you point right here.
Mm-hmm.
Oops. Sorry, right there. Measure that. About 8 centimeters there. And then I can also verify this with a scratch test. Release. Okay. All right. Next I'm going to go ahead and locate the spleen as well. Okay. That's about mid-axillary as well. Okay, so next, well, what I'm going to go ahead and do is do some palpation where I'm going to do light and then firm. So light, feeling for any pain or tenderness there. All right, I can go ahead and have you kind of like lift your knees, bring your knees up. Okay. I'm gonna go ahead and do deep there. This is primarily for testing or feeling for structures or abnormality. All right, go ahead and try to extend.
I can't.
All right, so I'm gonna do some specialty testings. We'll start with the Roswing sign. What I'm gonna do is palpate on the opposite side here, trying to accentuate any pain brought on by appendicitis. Any pain there?
Mm-mm.
Okay. Next we can do the psoas sign. Can you raise your leg up? I'm going to try to push it down, extend. I'm going to try to push it down, push against my resistance.
Oh, you need to push.
Yeah. All right. Also going to go ahead and externally rotate your hip. All right. And then also locating McBurney's point, 2/3 from the iliac crest to the umbilicus, and then we would pain with all of these.
I think it's just digesting right now. I'm just pushing on it all. I should
Hold on. This is kind of weighing up. Let's see. Next, we can go ahead and do the Murphy's sign, where we try to palpate the liver. Alright, so palpating here. Go ahead and take a deep breath in, or putting my hand beneath, and exhale. Sorry. What does that say? All right. No pain or tenderness there.
No.
I'm going to go ahead and do same for the spleen. And breathe out. Sorry, yeah, deep pressure, sorry.
Not used to it.
Let's see. I'm going to go ahead and test for your femoral artery. That's a 2+ there. I can go ahead and test for inguinal nodes. Do that on the inner thigh as well. All right. Next, I'm going to go ahead and do pedal pulses. Go ahead and extend. I'm just going to do this on one side. We will normally do this on both sides. No socks, no shoes. 2+ there. Tibial. 2+ there. Two plus. And then again, we would normally do this on both sides. All right, what we can do is do the musculoskeletal portion. Go ahead and sit up. Perfect. All right, we're almost done, maybe. All right, so next for the musculoskeletal portion, if you can go ahead and mimic my motions. How are we gonna start? Let's see. Okay, so let's see. Let's go ahead and raise our arms up and back down for extension and hyperextension. Go ahead and bring them up out to the side. And abduction, kind of all the way down. Hug yourself. Okay, perfect. So now we're gonna do like internal rotation. Okay. Okay. Perfect. So go ahead and arms straight. Okay, don't let me move you. 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 Go ahead and bring your elbows in, kind of like this.
Okay.
Okay, and then again, don't let me move you. 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 Okay, so move your hands down, up, extend, hyperextend, kind of push them further back, your wrists. Okay, and then down. Perfect. Go ahead and bring your arms up like this. All right, don't let me move you. Don't let me move you. And then again with the wrist, I'm going to try to turn it. Don't let me move you. Okay. Don't let me move you. Don't let me move you. Go ahead and squeeze my hand. So gentle, thank you. Okay. So next I'm going to go ahead and just for a rotator cuff. I know this one's going to be the issue. Alright. Okay. And then typically kind of bringing that back down. Okay. Now kind of pain. Go ahead and like firm shoulder. Okay, good.
Like that. Dancing.
Okay. All right, good. Now I'm gonna test for any like tingling of your hand. Let's see, so pain there?
No.
Tingling. All right. We can go ahead and do the phalanx. Go ahead and kind of hang. Normally we would do this for about a minute, but we're not gonna do that. Okay, release. All right, now I'm gonna move on to your leg. Go ahead and down. Any pain there?
No.
Turn this way. Any pain there?
No.
Alright, so we'll do the Brzezinski and Kernick sign. Go ahead and lay down. Alright, go ahead and up.
Oh, okay.
Alright, so extend. Any pain there?
No.
Okay. We would typically do this on both sides, but this space does not allow for that. Alright, so see, I'm going to go ahead and lift your head up. Any pain there?
No.
Pain there? Okay. Let's see, we'll go ahead and do valgus and valrus. So I'm going to do external here. Any pain there?
No.
Okay, so now for internal rotation, rest. Any pain there?
Uh-huh.
Okay.
Yes.
Okay. Let's see. So I'm just gonna check for range of motion here.
That's necessary.
Alright,
Where's
I'll go ahead and try to do a displacement of the tibia or check for any movement of it. Of course, typically we don't want it to move. Okay, so no movement there. So I'm gonna try kind of firm here. Alright. So no movement there. That's good. And then for valve rest, what I'm gonna do is try to do internal pressure here. Again, looking for any movement or displacement. Okay. Okay, so that was, okay, so the valgus and then valres again with the outward motion. Okay, next I'm gonna check for any swelling or fluid buildup into the patella here. We're gonna do alright, so for the bulge, we also have no fluid buildup, which is good, and then we would do the same on both sides. Any other specialty tests? We're gonna do the straight leg test. So I'm gonna go ahead and just passively raise your leg straight. Any pain?
Oh.
Okay. Again, same on both sides of this test for radiculopathy, any like shooting pain, kind of. I'm gonna go ahead and start testing for dermatomes. L4, L5, and you can't see the foot. Okay. L4, L5, S1. Go ahead and let me know when you feel something. Okay. Okay, perfect. All right, you can go ahead and sit up. All right, so hands out. I'm gonna draw a number on your hand. Let me know what it is.
3.
Okay.
1.
Okay. Good. Testing just for sensories. So next I'm gonna go ahead and give you an object in one hand. Close your eyes. Can you tell me what that is? In one hand.
A pen, maybe?
Okay, good.
Oh, it's huge.
Alright, I'm gonna go ahead and do a different object. Go ahead and close your eyes. Different object on the other hand.
A remote.
Yes. Typically we would only want to use one hand, the side that we're testing on.
Oh,
Okay, now if you can go ahead and extend your arms this way. Okay, now go ahead and touch your nose with one hand, the other hand. Okay, now go back and forth a little faster. Okay, good. Now go ahead and like slap your thigh with your hand and then with the tops of the hand, and then go ahead and alternate. Okay, perfect. Now go ahead and touch the tips of the fingers a little faster. Okay, good. Now we can go ahead and do the reflexes. Where's my pen? We're gonna do, go ahead and relax right here on reflex. Okay, and do see, we can go ahead and move. I guess we can move down. Can you go ahead and try to like tingle your feet, your legs? Okay. Good. So go ahead and do tibial. Okay.
Sorry. That one's a little dead.
And then again, just doing sensory tests.
Yeah, I don't like that.
Okay. Well. Okay. Well. All right. You can lower your legs. Now you can go ahead and stand up. And hold your arms out like this. And arms down. All right, so go ahead and walk towards me. Okay, and walk back. Okay, can you walk towards me on your toes? Okay, and back with your heels. Good. And if you can walk towards me doing kind of like heel, toe, heel, toe. Okay, good. All right, so now I'm gonna go ahead and just look at your spine. All right, so go ahead and tuck your chin in, chin to chest. Okay. All right, go ahead and bend forward, touch your toes. All right, go up. And girls from 10 to 12 and boys from, what was it? I think 12 to 14 will do this for scoliosis testing as well. And then for peds, we would be doing like Barlow, where we abduct the hips and flex the knees, and we would try to dislocate the hip, and then we would try to, dislocate the hip from the acetabulum, and then we would end up doing the opposite as well, where we would try to push the hip back into the acetabulum. And typically that kind of specialized testing is done from infancy or newborns to about 1 year. Forgot to mention that earlier. Okay. Kind of face me here. All right, if you can go ahead and arm out and slowly bring it back, the opposite side, and slowly bring it back. Okay, let me see, I'm gonna have you turn around. Go ahead and bend forward. Okay, flexion, and then lean back towards me. I'm going to keep your hips steady. Back towards me, extension. Okay, now I'm going to have you, can you run your hands down your knee or down your leg? Okay, and again, down the leg. Okay, and trying to see if there's anything else. Okay, so I'll go ahead and twist to the left, twist to the right. Okay, and then if I can have you move it, yep, and the opposite. Okay, okay, and then I will also have you use my hand, pretend like it's a wall. And if you can just kind of like do like a squat, keeping your back nice and straight. Okay. All right, and I think that's it.